Well, good morning, everyone. My name is Cornelia Stevens. I'm the Executive Director of Top Priority Learning Centers in Wichita, and I have the privilege of being the chair of the Early Childhood Recommendations Panel. I would like to welcome everybody to today's meeting and thank everyone on our panel for serving Kansas children and families. This is a remote meeting, and today's meeting materials are posted on the panel meetings website and on the Children's Cabinet's website, kschildrenscabinet.org. Panel members, please clearly identify yourselves before you begin to speak. You can choose to use the raise hand feature, but that's not necessary. But if you want to do that just so that we know that you would like to share, that would be great. For our agenda for today, we are going to approve our April agenda, approve the March meeting minutes, a Kansas Open Forum if we have anybody that presented information to share with the panel. I'm going to give an update on the Kansas Early Childhood Transition Task Force. We'll have an update on the Child Family Wellbeing Dashboard, the Kansas Community Data Dashboard, All In for Kansas Tactic Work Group reports, panel updates, opportunities for you to share bright spots, talk about upcoming meetings, and then we will adjourn our meeting for the day. So we'll start first by approving the April agenda. So Lindsay sent out the April agenda. And so if there are no modifications, may I have a motion to approve the agenda?
Cornelia, this is Jennifer Francois. I move to approve the agenda.
Perfect. May I have a second?
This is Natalie McLean. I second.
Perfect. All those in favor, thumbs up or say aye. And any opposed? Perfect. The March minutes were also sent out. Do we have any modifications or adjustments to those minutes? I don't believe so. No. So if there are no changes, may I have a motion to approve our March minutes?
This is Maritas. I move to approve the March minutes.
Perfect. May I have a second?
This is Donna Chestnut. I'll second.
Thank you. All those in favor say aye or thumbs up. Very good, very good. And any opposed? Perfect. So the first thing that we're going to do, we don't have anybody actually for our Kansas Open Forum. And so, but please know for those who are watching the live stream, if you have any information that you want to share with the panel, please send the information to, there's an actual Kansas Open Forum comment form on the Children's Cabinet website for the panel. Please send the information on the Thursday before our panel meeting so that we can either be invited to share information with the group and you can stream with us or we can just share information that you've presented. So we do want to hear from people. If you have information that you want to share, that would be great. But as of today, we don't have any information, anybody that submitted information for the open forum. So I'd like to start by giving an update on the Early Childhood Transition Task Force. And so, if you are not aware, Governor Kelly actually appointed members to a Kansas Early Childhood Transition Task Force for the purpose of really reviewing our early childhood programs and systems and creating a new state cabinet level position and agency that is going to really better support the services provided to Kansas children and families, and hopefully also streamline things for providers as well. We had our first meeting on March the 31st, and I serve as co-chair of the task force, and we have the Hunt Institute, who is actually guiding this work for the state of Kansas. We had an opportunity to hear from representatives from all of the state agencies who provide services to children and families. And it's not just childcare, but it also can be home visiting services, for example, and even like the benefits that people get for TANF, et cetera. And so it's like all of the services that are provided to help support Kansas children and families. Where we started is just trying to get an idea of, what does it look like in the state of Kansas? And are there any overlaps? Are there things that maybe are kind of contradicting each other? Are there processes and systems that are really overbearing for the people who are receiving the funds or for the families who are accessing the funds? One of the things, for example, that was discovered is that for parents as teachers, we have 3 different state agencies that are funding parents as teachers. And so if you have funding from all 3 of those funding streams, you have reports and data that you have to present to all 3 of those agencies. And so is there a better way for us to do this? Where the families can get what the services that they need, but where the providers actually have a process that's a little more streamlined. That's just one example of the ahas that we left, just on day 1. It was wonderful to see all of the state agencies there and collaborating and kind of thinking out loud and just having open dialogue. But really the first meeting was just let's figure out where we are before we determine where we want to go. And so our next meeting is going to be on May the 16th. And we hope at that point to have people from other states who have done the same thing. There are several states who have really combined and consolidated the early childhood system into one cabinet level organization or agency. And so we want to be able to hear from those states in terms of what they did, what were the hurdles, what were the successes, and what are they seeing now in terms of, quality of care, in terms of systems improvement, even fiscally, where there are cost savings that were identified, where more money can actually go to support children, the services for children and families. And so it does seem like this is going to, it's going to be a lot of work, but it's also going to be very exciting in terms of, what we want to look like when we grow up in the state of Kansas, and I love that we're having this dialogue. The goal is to have recommendations and a plan and everything in place by the end of the year. So this is not going to be a multi-year project, or at least the beginnings of it will not be a multi-year, project. We hope to have things in place by the end of the year, but we're just, again, we're only starting meeting 2, in a month. So I just wanted to give you an update as we have new information that's learned, or anything that I feel would be, that I think would be good to be able to share with everyone so that what's happening in terms of the task force. I'll be sure to bring it to, to the table. Questions or comments from anyone regarding that? Okay, okay, perfect. No, okay, very good, very good. Next, we are going to have Megan, who is going to give an overview of the Child and Family Wellbeing Dashboard. And so, Megan, I will go ahead and pass things over to you.
Thanks, Cornelia. Hi, everyone. I'm Megan Chizek. I'm an assistant director at the Center for Public Partnerships and Research at KU. And my colleague Maggie Hart has also joined me today. And we're going to hold what we're calling a discovery session. So I'll tell you a little bit about the dashboard if you want to. Thanks. So we are working with the Children's Cabinet, utilizing community-based child abuse prevention, or CDCAP funding, to support the development of this dashboard. And the intent is really for this to be an interactive dashboard, much like you would see a map where you can kind of click on different counties and data. But in order to identify what data and what things that we want to include in the dashboard, we are meeting with different groups in Kansas, including this group. And we just met on Wednesday with a group of family council members from the Family First Family Council, and we'll be gathering information from others to really shape this discovery session to build a strengths-based dashboard that really tells us what well-being means and how we are going to define well-being for the purposes of this dashboard. And one other thing I would mention is that the dashboard is really intended to be not just data, but really to help make sense of the data and then help guide people to strengthen their well-being indicators. So the intent is to have county level and statewide data that builds an index, essentially a well-being index that tells us how well our children and families and communities are faring, and then kind of makes meaning of that data. So we can say, what I like to say is the so what, now what? So what does this data mean and what do I do if my data isn't strong? So we are going to provide some best practices or some guidance, some connections to other communities in Kansas who have perhaps strong data in a particular indicator that can help another county or another region strengthen their data. So again, I mentioned it, we're building this in a strengths-based fashion. So we really don't want it to be deficit driven. We want people to know, here's where I am doing well, and here is where I can strengthen, so that we're really thinking about it in terms of this kind of well-being concept as opposed to risk. Let's see, did I miss anything? And this is really, it's intended to be for all audiences. We want it to be accessible to community members and leaders, as well as providers and policymakers. So it's really kind of an all-purpose tool. You can go to the next slide. So as I mentioned, this is really a discovery session. So I have some questions, and we just want to hear from you, from your perspective, whether that be kind of from you as the person or you as the early childhood key participant in the community and a community member. And as you know, a member of a family and a community, what well-being means to you, and how we can begin to define that in a way that translates then to data. So I will go through one question at a time, and I would just encourage you all to share your thoughts. The more interactive we can be with this, the more helpful it is to our building of this data. We are going to be doing a lot of kind of deep diving into other data and well-being indices that are out there in the world, but we don't want to create this tool without the voices and input of Kansans. And so this is really important that we're getting this information from you, and your different perspectives will shape how this tool unfolds. So to kick it off, I will ask, what does child well-being look like to you? And feel free to just come off mute.
Hey, Megan, this is Brenda Bandy with the First 1,000 Days and the Kansas Breastfeeding Coalition. And I bet you can imagine what I'm going to say. We think that breastfeeding is a great measure of how well families and children are thriving. Because when families are able to meet their breastfeeding goals, all families are thriving because there are systems in place. And I would also like to have us consider the prenatal period as well. I'm not sure if your funding defines, 0 to 5 or what, but obviously we're the first 1,000 days, so we're interested in prenatal to age 2 specifically. And then also, what are the measures around breastfeeding? And we do have data that we're happy to share.
Thank you, Brenda. And I will also just add, we'll just expand this question to child well-being and family well-being, because I feel like they're essentially very similar. I suppose we could get different responses for that, but we'll go ahead and put those together. And I don't want to restrict this to any kind of numbers or ages. So Brenda, that's great. I think it's important that we're thinking about it as holistically as possible.
So I don't know, this is Amy Gottchammer with Googles of Learning. I don't know if you're looking for something that is necessarily measurable, but I think in terms of children's social emotional skills and the parents' education in terms of skills building and how in the knowledge that they have to help develop that with their children.
Thank you. And don't limit yourself to things that are measurable. We're just kind of getting out, like, what does well-being mean to you, whether it's something we can equate to a measure or not. We just really want to think about, we don't want to limit it to what's out there. We want to think about it as kind of comprehensively as possible. So thanks.
This is Aldana Chestnut with Johnson County Child Care Licensing. And I think, from our standpoint, from the licensing standpoint, we look at child well-being as a happy, healthy, safe learning environment. So that includes, not only their mental health, but their physical health and their access to healthy food, activity, mental health services if they need them. That would be my thought.
This is Riva Waiwatis, and I love that, Eldana. I love that definition. It encompasses what I was going to say, and I think from the family perspective, it's making sure that families have access to the resources and information they need to provide that for their child.
Hi,
This is Lisa Schmidt, and I'm the director at the Women's Community Y in Leavenworth. I'm going to bounce off of Riva's idea of resources. Not only are they available, but do the families know about them?
This is Maritas from the Kansas State School for the Blind. I look at it as like what you have said, well-being encompasses range of factors, includes physical health, nutrition, medical care, access to services like what everybody else says, social, emotional, stable, supportive home, opportunities for play exploration to develop social skills as well.
Hi, this is Tara Taylor with USD 470 Arc City Pre-K and Head Start. And I would just say we've been focusing a lot on developmental screenings and parents having the tools in their toolbox. Number one, to just know about developmental screenings, and then access to what if there is a potential delay and where do I go next? We're kind of rural. And so that's a huge struggle here. And then also just parents having knowledge about ACEs and how trauma can impact students' development.
This is Emily Barnes, and I don't really have anything different to say other than just having the perspective of, I think for the parents, them being able to put in perspective well-being is knowing that they have, like, in their provider, whether it's medical, childcare, school-based, whatever it is, that they have a resource that not only do they know their child is physically and emotionally safe, but that they have the ability to have a conversation and truly learn why that environment is high quality. And that's part of the relationship, when they can have a trusted relationship with whomever is providing the service and care to their family. That helps with their well-being.
Yeah, I was thinking, that made me think off of Emily's point of, trying to, and I don't know how you would quantify this, but when thinking about ACEs, just tracking the amount of safe, stable, and nurturing relationships that a child has in their life. If that be, what does that look like? How do you measure that? I think would be really interesting to have, more data on for communities.
I don't want to interrupt anyone's thought, but I can go ahead and shift to the next question, but feel free to come back to any of these as well. So what does it look like for children and families to experience well-being? How do we know that children and families are experiencing well-being?
This is Dominique Lewis. I'm over at Children's Mercy. For me, I think the experience is authentic when all types of families are experiencing this well-being. And when I say all types, I mean various cultures and socioeconomic statuses and ability levels.
This is Brenda Bandy with the First 1,000 Days. And I would add on to what Dominique just mentioned, that we have a broad definition of what family is also. And I would say allowing them to define their stress levels. To me, I think stress is the biggest indication of how well things are going. And everybody's stress is going to look different and stressors will look different. But I think checking in with families and asking about stress.
Sorry. Oh, sorry.
No, go ahead.
Go ahead. I was talking and I was muted. So this is Marita's. I agree that it could look different for different cultures as well. Variety of factors, culture, environment, individual circumstances.
This is Megan with DCF. I was just going to add, I think part of is that basic needs are met, right? That those are there, those are met, so that families can work to get access or work to receive the resources outside of those basic needs.
This is Emily Barnes. And I think one of the things we also have to factor in, this is probably one of the most subjective and fluid elements of all of this. I think that this is one that very easily could turn into the professional in the situation believes that they have established a sense of well-being for the family, but the family may not perceive that themselves. And so I think that I think we're going to see that it's going to be hard to quantify and qualify and also maintain that, because you could, a person could walk out of a conversation, like say with me, could walk out of a conversation with their family childcare provider feeling like, okay, we got this. And then they get home, but because they're not professionally trained or, other elements that didn't come into play in the conversation, factor in at home, then they're kind of back to square one without that professional support. And so I think that is one that we have to be sensitive to the fact that this is a tricky metric and may be difficult to track accurately, although it is probably one of the most important.
So Emily, I appreciate that. It is super subjective, and that's what makes this hard. And a lot of the kind of reason that we decided to pursue this particular project and dashboard was out of the work we're doing through Thriving Families, Safer Children Kansas, which is really intended to help us rethink the child welfare system as one of child and family well-being. And so it is super subjective, and there's many ways that you can kind of go forward with that. But part of this is really to help kind of provide some kind of standard, or I don't know that we can come up with a standard, because there are so many different families and cultures, and we can't always tell that someone is experiencing well-being just, like looking at them and saying, oh, check, 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 right? So it is challenging. And so that's why we really want to hear kind of different perspectives and get the different input to build this out. So my next question, and you guys have said a lot of things, but what do you ultimately think are key ingredients for well-being? Like if you had to make a recipe, what are some of those key ingredients that are going to go into creating well-being for children and families?
This is Emily. I'm going to say trust.
Basic needs, housing, food, security, community, all of those are absolutely necessary for well-being.
This is Natalie McLean. I think I would add to that the social emotional health along with physical health.
And this is Amy Gottschammer with Google of Learning. I would piggyback on Natalie too and say with the social emotional health of both the children and the adults together. It kind of, it all makes me think of the whole strengthening families model, I think, put together.
I go back, this is Brenda Bandy again, to the reduced stress. And I think having a warm chain of support is the way I describe it, but taking the burden off of the family to make that chain themselves, but to have people in the community that are proactive in providing that support to reduce stress.
This is Cornelia Stevens. I would also kind of to add to that, maybe defining it as connection, so that, you know, the parent has connection either to other parents, but also to support, but really so that they're not alone. There's not a feeling of being alone, you know, and so having that connectedness, but then also that child having that opportunity to also have connections, you know, as well.
This is Crystal Henry with the Family Conservancy, and I definitely agree with all the things being said, connection, especially, and then a sense of belonging and inclusion is popping up. I'm just an intentionally inclusive environment.
This is Lisa Schmidt, and the one thing that I don't think any of us can identify is what your perception is. If you feel there's an unquantifiable feeling piece to it, and that's very individual.
I wonder if you can get to part of that by asking if a family has opportunity for pastime / play / self-care, that thing that a lot of people will go with, the stuff that will go by the wayside when a family is stressed.
Adding to Trish's thought that also if they're not in a safe environment or if they are low income, they're not going to have time for that free time because they're either going to not have a safe place for their children to play, especially in an outside environment, and or they're not going to have time where they're not either working or trying to rest or trying to do, you know, just the basic life survival skills, and they won't have time for that very important connection time with their children.
This is Brenda again, and I just want to be very explicit about something Natalie mentioned in her list was healthcare, access to quality healthcare.
Yeah, and just to piggyback, sorry, I just real quick, Donnie, I would just want to specify, I think both mental and physical health care.
I was just going to add in, Megan, also equitable.
This is Kim Kennedy, and I was also thinking the same thing, just equal access to services for everyone in the community.
I appreciate that, Kim, but I just want to throw in a little note there. So I chose equity over equality because, you know, equity considers the individual specific needs of the child and the family. So kind of meeting people where they are and then addressing the specific need that they need, that the child, the support that child would need to be successful.
I really appreciate that, and kind of on that, like meeting people where they are, ensuring that those systems of support are not don't feel like you're judging a family for where they are. Like, we're meeting you where you are and we are respecting where you are in order to help you.
I was thinking just to kind of build on several people's points, because Crystal, you mentioned belonging and on that idea of, you know, having those, creating those connections to help families. I think there's also kind of that when people feel like they can reciprocate, so it's not just them receiving help, but that they can give help too. So that idea of having that ability to, and knowing that you won't be judged if you receive it, but also having the capacity to actually help others, to me, is an indicator of well-being as well.
These are so good. I really appreciate your input on that. I'm going to shift us to kind of a different question. What does community well-being look like?
Well, one thing when I think about a community well-being, kind of ties back to a lot of the points already, but it's having access to safe places for families to interact and to get outside and to do things. It's also access to healthy foods, not just like the quick shop down the street, but access to fresh and healthy foods that are affordable. I think that's probably the connectedness. That's probably the three biggest things that would come to mind for me with a healthy community.
This is Natalie McLean. I would also say knowing where to go in your community. A lot of us know that there's places we can go, but do we know where those places are and how to get a hold of them?
This is Reva Waiwatis. I would just also add, when I think of community well-being, I think of the entire community and a community that cares for and about each other. So sometimes you're on the receiving end of that caring, and sometimes you're on the giving end of that caring. But I think of a community that thinks about the needs of all and everyone, and what part they can play in making that community a place that people want to be.
I was going to mention this is Trisha Wagner. I was going to mention the quality third place. So like there's the home, work, and third location where people interact, and ensuring that communities have third places that don't have barriers such as cost in order to participate in that third location.
What
This is
does
Cornelia.
sorry, Cornelia. I need.
That's okay. That's okay, Logan. And so the quantity of services available meet the demand or the needs for the families. So that when we have access, that it's not that we actually have the resources, the number of resources needed, so that people don't have to go without.
Logan Stensing here. I would say the civic and political engagement in that community, as well as like the self-efficacy of residents and their belief that they can advocate to change that community and to improve it.
Brenda Bandy, I would add economic thriving, economic security to that list.
So you all have kind of alluded to this a little bit, but maybe expanding on that, what organizations or places in your community help facilitate well-being?
As a health department employee, I'm going to say your local health department.
This is Amy Godshammer. I'd say your local resource and referral agencies, your public library.
I would add green space.
Brenda Bandy, I would add healthcare systems.
This is Natalie. I know in a lot of small rural places that the school is kind of the only like building there, and a lot of resources can go through the school.
Oh, food access. Very important. Grocery stores with healthy options.
This is Emily
Cornelia. Sorry, Emily, go on.
I was going to say early childhood environments, whether that's centers and family, in-home providers. And I was to tag onto the schools. That's another resource.
And Mrs. Cornelia, and if we're really designing like the perfect, like what the community, then it's the community, like all of the community, all facets, whether it's the workplace, it's the hospitals, it's the childcare, it's the grocery stores, it's the, that we're all of those entities actually have a role and a piece, of being able to provide that family the well-being that they need. But I would have emphasized specifically, as Emily said, talking about, the schools, the child care centers, KCSL, we have statewide, supports or whatnot. And so, yeah.
We've talked a lot about that in our community too, Cornelia, and especially the word coordinated approaches to all of those. And, we're all busy and we're all focused doing our own thing, but how do we coordinate better to support each other?
This is Trisha Wagner, and I would add transportation and broadband access.
This is Lindsay O'Ryan. Jennifer Whiteford Hook is having some connectivity issues, but sent a message to me and said home visiting resources, school communities, and early intervention services.
This is Maritas. I also think about support that we give to our low incidence population. I know that this is a general thing. I also would like to add parks, recreation, where families can go and build relationships. Nonprofit organizations, we have a lot of those that can provide help in our community, as well as libraries.
So thank you. These are excellent. I am going to flip this and ask you what institutions can cause your community harm? What can harm well-being in your community?
This is Brenda Bandy. This is tough. I would say employers, from the sense that they may not be accommodating or as flexible as what parents might need. Employers sometimes.
And this is Cornelia, and I don't know whether or not I would identify specific businesses or programs, but systems are what harm, or harm well-being. Our processes, our systems actually sometimes create more harm than good because it makes access difficult. And there's too many hurdles for people to jump over in order to receive them. And so I don't know that I have a specific, like name of something institution or a program or whatever, more than it's our systems that we have in place to help don't always help. They actually create more barrier.
This is Maritas. I think if we don't have lack of information and knowledge about the resources that's available is harmful.
This is Lindsay O'Ryan for Jennifer Whiteford Hook. Lack of institutions making community referrals to needed resources.
This is Emily Barnes. I think one of the hard elements of this is that any institution could, in fact, by their action or inaction, have good intent and do harm. When, my answer earlier was, the early childhood community, centers and homes and all that. When we have a situation where a child has been hurt by a person's actions, whether it was intentional or not, that creates harm. And it may not have been something they intended, but then that breaks trust and makes it difficult for people to go forward. And so one of the hard parts is it can be difficult to separate the good intention from the unintentional harm that may, or intentional, that may have happened. Oh my goodness.
I know I've already spoke, but I just want to, this is Brenda Bandy again, what Emily just said about unintentional, creating unintentional harm. And I'm thinking that, for example, law enforcement in some communities can be seen as reducing stress, but in other communities, it's a stressor. So it's difficult to say that any one system is problematic, but I think it's how it impacts the community. And I would say law enforcement is an example of that.
Thank you. These are also really helpful. So I think if we have time, we'll ask 2 more questions, but we may only have time for this last one. So I'm going to ask, from the early childhood perspective, from your perspective as a panel member, how do you facilitate child and family well-being?
This is Aldana, and I guess from the early childhood perspective on well-being, a couple of options. One is, of course, with our prenatal program, to Brenda's earlier point, making sure there's access to prenatal care for a healthy outcome. And then, of course, our WIC program, making sure that if people know about it, to other people's point, that pregnant moms and moms with young children, that they receive adequate nutrition so that they can have healthiness, which will lead to increased well-being. And then I guess from the third point, from the child care standpoint, trying to make sure that daycare providers especially know where the resources are and support them. And then also our mental health department, the Johnson County Mental Health Department, has a lot of programs and materials and access available for people. It's just kind of getting the resource to the people, I think, is the challenge to that.
I would just add that I think a lot of this has to do about information and we talked throughout this discussion about the importance of people even knowing services are out there. So I think advocacy and public information plays a big role in helping everyone see that they are part of the solution for supporting families in their communities, regardless of who they are, regardless of whether they have children themselves. But that whole "it takes a village" mentality, and making sure that those opportunities when decisions are made on any level that impact children and families, that people understand what's being discussed, why it matters, and how they can make their wishes known, or their provide input into the decision-making process is probably a better way to say it.
This is Natalie. I think many of our responsibilities on the recommendations panel include influencing quality practices and developmentally appropriate practices of people who are working with communities and children in our communities.
This is Jarvis here. I know I'm thinking of our program, trying to make process is easier. So whatever that, I mean, anything that's similar to, you know, how an application is viewed, we may look at it one way, but making sure that interpretation and that information is clear, not to us, but to providers and to our audience. So, you know, that's one thing we really focus on, is just understanding and making things easier to access.
This is Amy Gottschammer. You know, since I'm a director and boots on the ground, so to speak, you know, ours is a lot of just direct communication, building trusting relationships with the families. You know, whether it's education, whether they're asking us questions about in general, you know, how do I deal with behavior and guidance, looking for suggestions, you know, how do you do it at school? How should I help guide my child at home, or helping them with sleep strategies or something else? And of course, making referrals to community resources, or bringing in those speech therapists or whatever into the building, letting them know who's out there to help them, and even connecting them with each other, the different families within the program. Hey, you know, there's another family that can help you with this, and getting them connected to each other so that they can support each other, because they're part of a bigger family here at our school. So all of those things come into play.
This is Trisha Wagoner. I think about how do we bring services to families, rather than assume that families have the time or resources to seek us out, because that's two very different ways of providing services. And one really helps eliminate barriers, whereas the other assumes that a parent or a family has the time to seek services that they need when they might not even know that they're out there.
This is Maritas. I also think about collaboration and partnership between agencies, because we care. We have a lot of agencies out there that are with the same purpose in helping and supporting families and children. So I think collaboration and partnership, knowing what each of us has to offer. So when someone asks a question, that we know where to go and make referrals.
This is Crystal Henry with the Family Conservancy, and some of this has been said in maybe different ways, but just maybe to Trisha's earlier point of meeting families and providers where they're at. And, you know, for our Start Young program, it's not a one size fits all. It's not, you know, you agree to do this and then you have to do these 10 things, or you get these 10 things. It's, what are your needs? What is your capacity? You know, for families that we're meeting with, what time of day works for you? Email or phone or text, or, you know, this, that, or, so just essentially making things harder on us. So it's easier on providers and families, and taking into account where they're at a certain point in time. Maybe we pull back coaching a little bit when you're really short-staffed and you're overwhelmed, or maybe we bring more on so you feel more supported. So just really specifically designed supports to meet people's needs at a given point in time.
Well, I want to thank you all so much for your contributions. I feel like we could just do this all day and still keep coming up with amazing things that will really help shape this tool. And hopefully in the next year, you will have access to this tool and it will be of benefit to you in all that you do. That said, feel free to email me or Maggie. Perhaps Lindsay or Julia can drop our emails in the chat. If you have any additional thoughts or things you want to add, feel free to email either one of us anytime. And thank you so much for your participation in this today. It's good to see you all.
Megan, thank you so much for sharing. You're totally right. When you think, it's great to have, the think tank like this, right, where you have all of these people who are, committed to providing services and access to children and families. and then you have all of these aha moments where you think you've kind of uncovered everything, and then, so it's great to be able to hear, you know, not only what we're already doing, what we're doing well, that we can all like talk about things that we already have in place for well-being, but also kind of to think big in terms of what more we can do. And so, so thank you for doing all of this. It'll be exciting. Next, we're going to hear from Sarah Gardner, and she is going to talk about our Kansas Community Data Dashboard.
Thank you, Cornelia. Hi, everyone. I'm Sarah Gardner. I'm an assistant director at CPPR. I am here to talk to you about the data dashboard that is live. So I love the visioning that you all just did. And I'm going to take us into a resource that is currently available and hopefully give you a little bit of insights into how to utilize it in your community. I did do the webinar presentation on this from Wednesday, so there's 30 minutes of me talking about the dashboard. If this is too little information, I'd encourage you to look at that recording. Before I do dive in, I want to just call out a couple other resources. So we created a data dashboard with very specific purpose and indicators, but we also have really good resources already in the state. So I want to point out the Child Care Aware Point in Time Count, which tells you about demand and supply in a county for childcare, for licensed childcare. Kansas Health Matters also has a very robust, like full spectrum, all the statistics you might want to know about your community's health. They define health quite widely, so I would encourage you to look at that as well. And then, of course, the KSDE Data Center has a lot of information about school districts and sort of the education in Kansas. Next slide. So then why did we create this other dashboard? What is the value add to this? The point I want to emphasize with this dashboard is it's a collection of indicators across health, education, and care with story pieces embedded in it. So it's a really like tangible tool that you can grab charts, you can grab narrative, you can see links of different data sources that are out there. So it's meant to be absorbed in either in bite-sized chunks or as a full picture data story. So it's really about the story of the data and not just the statistics and the numbers, which we think is really important, particularly for folks who, you know, decision makers don't have a lot of time to, you know, parse through pages and pages of data. So the more quickly we can get to the so what, the story piece, the better we are. We did actually create this full transparency, anticipating a potential grant application that we're still hoping to be able to open. So we wanted to create something that as applicants, as community applicants, you could go in and you could grab something really quickly to help you turn that sort of need statement around in your grant application to really support you as you tell the data story of your community and what the need looks like. Of course, we want you to use these in community conversations with decision makers, whether they be elected or appointed, or just folks who have agency in your community to make change. And then recognize the connection points across 3 sectors: health, care, and education. Care, health, and education, I'll say it that way, so health and care doesn't run together. You know, a lot of times these funding sources silo these services out, but families experience these as one life experience. And how can we better understand where those indicators overlap and have impact? I'll talk a little bit about where the data comes from and how to export when I get to the demo. So what are we going to be looking at? First of all, I want to call out our partner, My Sidewalk. It's a company out of the Kansas City area. I know they have partnered with other folks in the state of Kansas to really help improve data literacy and tell that data story. So that's the platform that we are leveraging. It's 20 different indicators across 4 specific categories. There's one data set that we are graciously getting from Child Care Aware. Everything else is publicly available. So it is all data that already is out there. We're just leveraging it and pulling it together in a way that you can easily access and tell that story. You'll be able to select a geographic boundary at place, at what we call the place, what is also a census tract, and then also by county. And I'll talk you through that, as well as different charts and graphs that are all exportable. each indicator has some intro narrative to understand, like, why am I looking at who has SNAP benefits in Kansas? Why am I looking at who has access to transportation in Kansas? Helps sort of give you that intro that you might need to help contextualize the data as you share that with others. And you're welcome to just copy paste it, to pluck it, and drop it into anything that you might think is helpful with. Some just key understandings as we look at the data dashboard. There's always limitations with data, and I just want to be super transparent about what those are with this particular dashboard. The first is the data is as live and updated as the source itself. So if it's a data source that is updated on an annual basis, that is the cadence at which that data is updated. So it's all dynamic. None of it is static. So every time you open it, you will see the latest data for that particular indicator. If data is updated every 5 years, which unfortunately a lot of publicly available data, particularly our demographic data, or some of our key indicators around our demographics, they aren't updated every year. And so just you'll be able to see the source as well, and you'll be able to know that. But it is as updated as that data source is. As I mentioned, you'll be able to select your geographic area. You'll also be able to select 2 comparison areas. So if you're looking at a county and you want to see how that county stacks up against neighboring counties, you can do that. Obviously, it doesn't have to be neighboring counties. You can select whichever sort of geographic boundary you'd like to do. I'll talk you through some of the overlay options, which help you understand why might I choose this boundary. So one of the examples is our partners at KDHE have shared the childcare facility location information, and we have laid that over the map. So if you're like, I want to look at how poverty relates to where childcare facilities are, you can actually click on that overlay and you'll be able to see where childcare facilities are. And then, that might help you make a decision about what you want to know about that particular area. The URL link is what the dashboard is. So again, it's always live and dynamic, and you'll be able to see that come into your email inbox. We do ask for that just so we can help understand who is looking at the data. We're not doing anything with your email address once it comes in. It's just for our knowledge of where folks are potentially having interest with this. And then you can bookmark the URL. You can keep it in your email inbox. Every time you click on that URL, it is live, it is dynamic. That I think is the real beauty of the dashboard. Go to the next slide. This is a bit of a mess, and so I'm going to actually, if I can, Lindsay, can I share my screen and walk through? I did this just so you'd have a flat picture of it if you're looking at the slides later, but I would love to walk you guys through just where to go to get this and how to potentially navigate it. So I go here. Okay. So where do I get this dashboard? It's the All In for Kansas Kids communities page. So you could just type in allinforkansaskids.org. You can click on communities, or you can just go straight to the /communities page. If you have been following along with our accelerator grant application process, this page looks familiar to you. Down on the right-hand side, we're really proud of the different resources that we've been able to share for folks. You're going to click on research and data. And underneath here, this is where you're going to see all 4 of those data sources that I called out. So the 3 that I mentioned, Child Care Aware of Kansas, the Kansas Health Matters, and the KSD Data Center, all of those links are right here for your convenience. If you click on the Community Data Dashboard, this is the page that it will take you to. And this gives you a little bit of an overview about all the things I'm saying to you right now. You can read on this page as well. And you'll just scroll down, and the dash or the geographic map is right here for you to look at. There is a user guide linked up here. So if you're wanting to just dive into deeper about like, what are some of those nuances, what are some of those limitations, you should be able to click on that user guide and see that information as well. So once I'm here on this map, it is live and dynamic. So I can zoom in, I can see the counties. I can start typing in, where I might be looking for, and whatever's available comes as a drop down for me. I can also go to this tab here that says geography type, and I can narrow in that. So I can do by county, I can look at place. which is a little bit more defined down to a specific place that has that publicly available data. I can also look at a census tract, and I'll scroll in a little bit so we can see where that might come into play. There, my census tracts start to show up. And then all you do is click. That's all you do, to click your geography, to select it. The first click you make will be your primary geography. That's where most of your indicators will show up. I can then click 2 other places, and those are my 2 comparison geographies. Doing comparison geographies is certainly not required, but it's an option for you if you'd like it. I mentioned the overlay list of the childcare facilities. There are actually 3. There's a qualified census tract, which has to do with HUD definitions. You can think of it as sort of low income as it relates to HUD. You can also, here's that childcare facilities overlay, which is really lovely. You can see the shaded areas. And again, if you hover, you'll see a number pop up. So we can kind of see there's 5 childcare facilities in this sort of geographic split. There's 1 here, 3 here, 2 here, 3 out here. Areas where there are none tells you what we probably already know, which is that we don't have enough childcare across the state. So I'm going to go ahead and select, I'm going to do Reno County as my, and then I'm going to do, let's do Rice County as my comparison. So these are going to be what I've selected. Then I'm going to hit this request dashboard. I'm going to go in here and just enter my information. If you would tell us what county you're in, and again, it's just information for us to know who's looking at things. You'll hit submit, and then you'll get an email that tells you that your dashboard is on the way. And here is what that looks like. So you'll get it, your Kansas Community Data Dashboard is ready. Get excited. You can scroll down, and this is that link that I was talking about. Again, super dynamic. So you can click, you can leave this link inside your email and just save the email. You can open the link and bookmark it, whatever you'd like to do. So there's a little bit of information here about what you're looking at or what you're going to be looking at. And here is the good stuff. This is the actual dashboard itself. So that's what we mean by this is the actual dashboard. It's kind of an odd name for what we actually are looking at, but this is the dynamic data sets. It functions just like a web page does. So it has navigation over here on the side. If I click on one of these, I go directly to that set of indicators. I mentioned there were 4 categories of indicators, 20 indicators across 4 categories. And we divided them up into greatest needs, essential family supports, childcare access, and community conditions and context. And I know I'm short on a little bit of time, so I'm just going to highlight a few key features of this. First of all is at the top of each of these categories, you will see the different indicators that we have selected for this particular category. So for essential family supports, you've got adults with poor mental health, people without health insurance, housing units without a vehicle, without a computer device, and we also have adjusted COVID death rate. And again, one of the reasons that these indicators were chosen is looking at health care and education across the board. So I'm going to start with greatest need groups. The first 2 indicators, families living in poverty and households utilizing SNAP. Again, here's that story piece that I was talking about. So, you know, this is, again, not something you all probably don't already know, but it's just nice to have a language that you can draw from. And then below it, you'll start to see the different charts. And each of these specific blocks is what we call them, the block of text, this chart, this chart, this chart, they are all individual links. They are all individual exportable features. So if I go over to the right of any of these, I will see what looks like a graph with an arrow. I click on that. I can export this as an image. I can export it as a CSV file. So that might be helpful if you're dropping it into a presentation, if you want to put it into something to actually share out. This sort of link button right here that's also off to the side, I know it's a little bit difficult to see because it's small. This is the link to this chart inside the dashboard. So you can actually, if you want someone to go right to this chart, you can grab that link and put that in an email. And rather than navigating the whole dashboard, they will go directly to this chart. So if you want to really point out some information. Below each chart, you'll see the source itself, and you'll actually see the date range for the data, which again tells you what's the latest available. And as we get new ACS data, this will update. The first data set you'll see in each of the charts is the primary geography you selected. So I selected Reno as my first geography and Rice as my second. It will also automatically try and find the largest sort of city or place area around it, as well as how it compares to the state of Kansas. So every indicator will also have the state of Kansas and how it relates. So again, it's about comparison and seeing how things go. So you've got 7% of families in Reno County are living in poverty. That's about the statewide average. It's higher in neighboring Rice, and it's higher when you drill down into Hutch. You also have charts, and I can click on any of these legends and I can remove that particular line. So if I remove the state of Kansas, I can start to see how Reno compares with Hutch, compares with Rice when it comes to families living in poverty over time, which is interesting because here's your percentage, but here's your raw numbers, right? Which percentages and raw numbers tell a different story. These dotted lines out to the side are a little bit of a run out and can tell you, so for example, this is a projection out to 2031, what we think the families living in poverty over time will look like in that particular county. I can minimize and maximize any of these things. So if you're like, where is that data set? It's likely that it's just minimized. Another thing I wanted to point out is when we have it, when the data is publicly available, there is a map feature, which is really nice when you have, particularly in Kansas, when we have some counties like Reno, where there's an urban area, I use that term loosely for Hutch, and then there's a surrounding more rural part of the county. And you can actually start to drill down into seeing, okay, I would expect perhaps more families to be living in poverty inside Hutch versus the county in general. And this can actually kind of clarify what that looks like and where there are needs. I bring this up because it's really interesting to compare families living in poverty map to the map of families utilizing SNAP benefits. You would think that these would be highly correlated, and you see some differences in accessibility and utilizing SNAP benefits. So different indicators. I'm going to go through one other thing because I know I'm at time. I wanted to point out the specific data set that is, again, graciously generated by our partners at Child Care Aware of Kansas. So this is your desired childcare capacity compared to potential demand. This comes from their WLS data. I will just note that this is data that has to be updated manually. And so you'll want to really look and see the date that this is pulled from. And if you want something more recent, definitely go to the Child Care Aware of Kansas website, go to their point in time tool and click on that, because that I know is more frequently updated because it generates automatically out of WLS. So this is the only data set that is not publicly available and is not going to be as dynamic and live as the rest of them are. So finally, the other resources tab here has exactly that, other resources. If you want to dive deeper into information, very key partners who do really good work to help us improve these indicators and make life a little bit better for Kansans. So that's what I have. And I hope that you will find it helpful to you as you are telling your story to community partners and thinking about where you can invest services for families. Thanks, Cornelia.
Perfect. I see, Maritas, do you have questions for Sarah?
No, I had a clap. I was clapping.
Okay, you were clapping. Okay, perfect. Does anybody have any questions? Sorry. Questions, comments at all? Yes, Brenda.
Silly question time. Maybe at a future meeting, or somebody can email me later and explain the difference between Megan's dashboard and Sarah's dashboard. Because I heard dashboard and my brain automatically went, what? So I'm sure there's a simple explanation, but I just need some clarity. Thank you.
I'm sure that's a question that others might have too. So I'd be happy to put that together and send that out so that the whole panel has that information.
Perfect. Any other questions?
This is Emily Barnes. And my question, like when we were looking at the childcare access, I didn't fully understand, like when you're looking at the, like 1 through 3 and 5 through whatever, is that all types of environments, centers, preschools, homes, or can you get more specific? Like if someone is looking at like, how much access do we have to center care versus how much access do we have to in-home care in an area? Like, can we get, I don't think I caught that element.
That's a great question, Emily. No, this dashboard does not have that level of granularity. So for that distinction between facility types, I would absolutely go to the child care where point in time for that information. And I also know we've got license exempt and we've got, other places that might not actually convey the full picture. So definitely a limitation of the data.
But if you're looking at like those, the gradation of the numbers of how many, that is however many we know about, all inclusive.
That's right.
In that total.
That's right. Yep. The data set specifically is about the capacity versus demand. So the gradation and the shading will tell you where is there a county where the capacity is meeting demand or closer to meeting demand, and where is there counties where it's not even close, right? And there are some counties where it's 40% is meeting the demand, which is, meaning that there are a lot of kiddos and families without childcare.
Any other questions? Okay, if there's none, Sarah, thank you so much for sharing this. I'm looking forward to kind of going through it and seeing what I can pull from it. Just to think it's always great to kind of see where we are in our community, and so that's great. So thank you for all of the work in this. Lindsay?
Just wanted to make a quick note that we had an interruption in the live stream while Sarah was doing the live walkthrough. So apologies about that, but it's up and running now. Luckily, Sarah did an amazing walkthrough during the All In for Kansas Kids monthly webinar. So we'll share a link to that and make sure that everyone can go back and watch that if needed. So hopefully we're all good now, but just wanted to note that in case anyone is watching, if you missed that interruption, there's great content available and we'll make sure and share it out.
Perfect. Okay, thank you. So next we are going to get updates, reports from our tactic work groups. And so in our last meeting, we kind of talked about the 4 different work groups that we'll have, this year for our panel. And the work groups met after our meeting, and then some met after as well. And so there is a person identified in each group who is been volunteered or voluntold to be the spokesperson, and so with that, can we hear first from strategy 4.2 on family-friendly workplaces?
Yes, thank you, Cornelia. That would be me. I'm Brenda Bandy with the Kansas Breastfeeding Coalition and First 1000 Days. And so our work group has met twice, and I'm just going to share with you what we've been doing. So first, we reviewed the resources that several of our work group brought together. So we looked at the organizations and agency list that was provided to us. We've also looked at some of the groups in Kansas that are working on this, such as Kansas Power of the Positive. And we have a new initiative that First 1000 Days is working on called Family Forward Kansas. And we are looking at, that is an education program for employers specifically around 4 policies: paid family leave, childcare access, flexible scheduling, and accommodations for pregnant and breastfeeding employees. So we've been spending a lot of time just discussing who is working in this area and how these different initiatives align. And then we have also looked at 4.2.1, which is identifying those resources. That's what we've done. I'm looking through our list here now. Partnering with employers was also the other one. And we have looked at what organizations are doing. Kansas Power of the Positive has been working with employers. So as the Kansas Breastfeeding Coalition, in addition to Child Care Aware and Work Well Kansas. So these were some groups that we've identified that already have connections with employers. And then lastly, we're looking at building the conditions that lead to safety, stability, and nurturing. And it again circles back to those groups that are currently working on that, specifically Kansas Power of the Positive and the new Family Forward Workplaces Initiative. So we are going to meet again on May 17th, and we'll be prepared to have recommendations at the June meeting. That's all. Any
Perfect.
questions?
Questions or comments for Brenda? No, well, it sounds like you've been active already, and so that is amazing. You know, it's kind of interesting when we hear about the when we just had the conversation about well-being, and one of the things we talked about is the workplace and the employer sometimes being you know, the entity that maybe can harm well-being unintentionally. And so so this is kind of good timing with all of this coming together and talking about how we can help our workplaces become more family friendly and how do we promote that. So so well done. So now we have an update from Tactic Group 6.6, which is compensation and benefits.
Hey y'all, it's Logan Fencing here. And so I, have been helping facilitate, and we had a meeting after our last early childhood recommendations panel meeting where we have a Miro board created where really a lot of the questions were guided by the what was outlined in the recommendations for, for what informed the recommendations. So like we're trying to figure out, a description of the council's committees, groups that are already doing this work. What are folks working on currently in Kansas related to compensation and benefits, seeing what kind of models are out there, as well as reviewing a lot of the resources about what's happening at the national level. So I feel like our group and folks feel free to hop in of, we're in this kind of a state of trying to assess the landscape and see what models are of interest to us to kind of pursue and to, I think, dig deeper into, and also thinking about for kind of the long-term professional development and career pathway for providers instead of maybe thinking about what are maybe more short-term fixes. So yeah, that's, I think, pretty much where we're at still. And I think as soon as we are able to convene as a broader group after we've all looked at the resources and all share what are some of the most maybe cutting edge or what we think could be impactful, it would be great to throw that out to the rest of the group just to get y'all's insights as well as to help us narrow down, because I think there are a lot of options, especially when you think of a big bubble like compensation and benefits. So yeah, that's, I think, where we're at currently.
Thank you, Logan. Any questions for Logan? See some thumbs up to you, so that's good. All right, Tactic Group 6.1.5. This is on recruitment and retention.
Okay, so that's me. I'm Amy Gottschammer. So, of course, when it comes to recruitment and retention of the workforce, everybody thinks about compensation, which was not our charge. So we were trying to think, how are we going to do that without paying them more, or and maybe in addition to, with any luck. Excuse me. So we are pretty much at the point where we are just still going through all of the resources. A lot of things have sort of risen to the top. We're maybe 2/3 of the way through the resources, but we have come up with, basically ways to attract. We're looking at ways of changing public perception, ways to grow our own within our own programs already, public awareness and outreach campaigns, sort of media education through media, things like that. And then working with the community colleges, CTE, looking for ways to create a professional feeling that as a value-added benefit, making them feel more like just more than just glorified babysitters, right? How do we get everybody to understand, not just the society at large, but the professional or the providers themselves, that you are professionals and this is something you want to be a part of. So that that was another thing that we talked about. Another thing that rose to the top in that might help speak towards not only recruitment, but retention, maybe specifically retention, was mental health supports. That might help keep them on board a little bit longer, maybe looking at ways to create a mental health toolkit for providers and directors, something like that, that we might be able to work on. We really haven't focused on specifics yet, just a couple of different ideas that maybe rose to the top. We're still looking at resources. We did not get an opportunity to do an additional meeting yet between this one and last, so I'm hoping to get another one in between this one and our next recommendations panel. So that's about where we are right now, I guess. So did I leave anything out? Anybody in my group? Any questions?
Okay, thank you, Amy. And then last, tactic group 7.1.2, looking at local zoning.
So that would be me, Aldana Chestnut, and we have also met twice. Excuse me, first we kind of, similar to what Brenda said, kind of reviewed what work is already going on out there and looked at the information that has been collected regarding city zoning with both from what child care licensing requested of child care surveyors across the state, as well as what the GO team has been trying to pull up by reviewing the websites of the various cities and counties. So that is already in a working spreadsheet. And so we kind of talked about what to do with that. And then we talked about the importance of working with other groups. And so I had actually done some research and was working with planning, you know, because you've got to work with your city planners and everything when you're looking at these, at the buildings and what's happening, et cetera. So city planning really has impact or input into the city regulations for local zoning, and not necessarily as much as homeowner associations. So we've kind of focused more on the city state zoning versus a homeowners association so far. But kind of looking at the possibility of working with a local, like the American Planning Association. They have a Kansas chapter. So possibly working with them to help to impact or influence some of the local zoning. And we have looked at some other resources across the state to see what our thought is, that we know what we've found from what surveyors are aware of. We know what's been found as far as the websites of what the city's saying. So another thought that's kind of formulating is to do a survey that would go out to childcare providers, home centers, preschools, Mother's Day out, to know what either they are aware of that hasn't already been identified, or if they're, maybe help to identify some misinformation. If providers are going, well, I'm required to do this, and it not really, maybe not be the actual cause. Figuring that we could, the results of that survey, all of these put together, would help us to tackle the higher priority of what the needs, barriers, and challenges are. And of course, looking to identify opportunities to streamline interpretations of regulations at all levels for consistency of provider experience. So I think that's kind of where we've at. We've had some really good discussion so far.
Very good. Any questions for Eldon? Okay, if there's none, well, thank you for the updates. We will have time after this meeting for all of the work groups to meet so that you can continue conversation, schedule your next meetings or whatnot. And so I'm looking forward to further updates from everyone. As a reminder, if you have any items that you would like to add to the agenda, things that you would like us to talk about, we're looking at May's and June's agenda. There is a place for recommendations on our website. And so please go on ahead and put in recommendations there if you have something specific that you would like to talk about. As a reminder, panel applications are due on May the 5th. And so it is a 1-year term. So it seems like the year went kind of quick. So it almost seems like we just submitted an application, but it's time for another application. And so if you have not already done so and would like to participate on the panel again, and we hope that you do, the applications are due on May the 5th. Please know that parents, we would also like your help in recruiting parents. We would like to expand the number of parents that we have, on our panel, recommendations panel as well. And so if you have parents of young children who are, who want to be active in the system, and share their voice in terms of the work that we're doing, please, you recruit and recommend, them for, or send them over to the link so that they can apply. And if in fact you decide that you don't want to reapply, and there's something that you feel like is that maybe we need to do better, in terms of a task force or anything like that, of a panel, please email me and let me know, if there's a reason that you're not, if there's a specific reason that you don't want to reapply, and or if you're reapplying, but it would be great for us to add something, so that it feels more engaging, or so that you feel, more involved in everything. Please feel free, to email me, cstevens@topelc.com. I would love to have your feedback. So next on the list is bright spots. And so give opportunities for people to talk about the wonderful things that are happening in your community, in your organization. And so do we have any bright spots to share?
This
Emily?
is all done. Go ahead.
So I was just gonna say, CCPC, we are more than halfway through our virtual conference this month. We tried out, we've been doing the virtual conference for the last 2 years. This is our 3rd year. Tried out a new format of doing it, Tuesdays and Thursdays every month. We're more than halfway through. We've had a good number of participants in each session, and we've had some new new presenters that we've never had before. So just wanted to highlight the work that CCPC is doing, and what the providers are getting from everything. And so just really excited and proud and happy about what's going on there.
Very good. Aldana, I believe you're going to go next.
Thank you. So a couple of things. One, I wanted to call out CCPC as well, because I think that I really appreciate our collaboration that we really have improved with, and going forward. A couple things that we're actually doing with, big thing we're doing with them is that we're having a childcare provider fair for Childcare Appreciation Day, and it's a collaborative effort between CCPC and Johnson County Department of Health and Environment. First time we've done that, so I think that's definitely a bright spot for our community. And then the second thing would be that we are hosting our first Johnson County Child Care Coalition meeting, and it will be on May the 1st. So I'm really excited about opportunities to move childcare forward in Johnson, Miami County.
Logan?
Hey y'all, Logan Stensing. I'm very excited. We are kind of in the final stages of drafting a job description for some regional field organizers for the Zero to Thrive Coalition. And that main focus is going to be this summer and fall, connecting to providers and community groups and coalitions, and really centering it on early childhood education compensation and workforce. And so I'm just very excited, because I feel like that's a very important part of the puzzle is, not only talking about these recommendations, but how are we getting that message out to communities, and especially folks that are often left out of the conversation, and sometimes, and they kind of hear about it on the back end. So I'm just very excited about hopefully trying to create some more capacity, and would love when we have a more definitive document to kind of share, and we're sharing it out there to leverage all of your networks to help us get some folks that are interested in doing this work. And and I know one of the big questions is like, how much would they get compensated? And that's currently what we're working through right now, with some budgets and having some conversation with other partners to make sure that program is as robust as we possibly can make it. So very excited about it, and would love to talk with you all more if you have questions or have ideas for how they could partner. Because again, we're only going to have 5 regions. I'm going to count as the 6th region in Southeast Kansas, and so that's a lot of counties to cover. So it's like that idea of how can we think creatively through using, childcare coalitions and the capacity of other organizations to kind of connect to really expand our reach throughout those various regions. So very excited. Thank you.
Very good. Brenda.
Thank you. Brenda Bandy with the Kansas Breastfeeding Coalition. And I have 2 very exciting pieces of news. One is that our childcare training that we've hosted for quite some time through Casito, called How to Support the Breastfeeding Family, is now available in Spanish. And it is taught by a lactation consultant who is a Spanish speaker. And so we are excited to be able to provide that with support from Child Care Aware of Kansas and KDHE. That will be offered 4 times a year. We just wrapped up the April course. It'll be offered again in July and October. You can go to Casito to look at the course. If you search breastfeeding, it will come up. So Spanish education opportunities, we know there is a great need for that. Second thing, an invitation to all of you and those to join the Kansas Breastfeeding Coalition childcare section. I know many of you are a part of that, but this is an opportunity to continue the conversation around the intersection of childcare and breastfeeding support. And if you would like to join and not sure where to find me, please reach out by email, and it's also on our website. Thank you.
No, thank you, Brenda. And Jarvis.
Thank you, Cornelia. Jarvis here with KDHE Childcare Licensing. Our team is very excited. We put together a new virtual education series. Some of you may have gotten some emails for that. If you haven't, let me know. I can get you a link to where to go and register for this. But we're going to be providing quarterly education for our licensed providers and programs. And so they have the opportunity to ask questions and we can give answers. But now we're starting this next week as our first session. We're going to have 3 sessions next week, and then we're going to follow up each quarter with 3 sessions at a specific week for that quarter. So we've already got a great turnout so far. We can see who all's registered, and we've got quite a large number of people. So we're excited about that. So if you need more information on that and how to sign up, just let me know.
Perfect. Well, thank you for doing that because, access to trainings at times that benefit providers and all that kind of stuff is huge. So thank you very much for doing that. We are going to have our next meeting on May the 19th, Friday, May 19th from 9 to 11:30. And then our Kansas Children's Cabinet and Trust Fund meeting is on Friday, June the 2nd from 9 o'clock to noon. And so all of the agenda and resources and everything for all of our upcoming meetings are available on the panel SharePoint Hub. And so you will have access to all of that. And so if we don't have anything else in terms of our agenda now that anybody would like to, any closing comments or whatnot, we're going to go on ahead and take a little bit of a break before we break out into your task groups. And so it is now 10:32 on my clock. And so let's go on ahead and come back at 10:40, and we will meet and through all of your tasks, through all of your work groups. And so thank you all again for the work that you're doing. I hope that you have a wonderful weekend and look forward to seeing you all next month.